That's good. This is my credential, and this is my financial disclosure. I always say in any I get paid by the government and the ETSU, so you guys are paying my salary. That is how it goes. Inhalant use. It's a very important, but also hard to find the information about it. Today, we try to talk about the epidemiology, clinical manifestation, toxic effect, and management of the inhalant. And as you all know, lots of other substances can be inhaled, such as cocaine, tobacco, marijuana, opioids. Some people crash the pills, snorted, and those are not going to be really discussed today. When you look at classification of the drugs in the inhalant use, there are three different so far. They came with the classes. The class of the that amyl nitrate is belong to, and the classes that the laughing gas is belong to, and also we go to the solvent and fuels and anesthetics. I took this picture from the book, to make this a slide, and it gives you a little bit information about the sources for all those classes that we just talked about. And so you can see that most of those sources that are listed in solvents and fuels and anesthetic are readily available to anyone that wants to purchase. For example, if you talk about the gas, any gas station, you can have the gas and use that one. DSM-5 TR is here. So they had a text revision of the DSM-5 from now. And the diagnostic criteria is not that much different from any other substance use. If you look at all the criteria, the 10 listed criteria here is similar to just take the inhaler off and put any other substances that would meet the criteria. So it's pretty much same. No need for the memorizing again. And the specification is almost the same. There is a early remission, sustained remission in control environment. And also going back on this one, if any particular solvent or any particular substance was uniquely used and there is no mixture of the several, you can always use the name of that particular substance. For example, if the toluene is the one that they are using, it can be used on that one when you name it. It does have the same category that you see on any other substances. If there is 2 or 3 symptoms is mild, it's 4 to 5 symptoms would be moderate, and more than 6 would be severe. Now, DSM-5 does not really recognize the inhalant withdrawal as much as the other substances as a disease. So you do have other substances that is listed as an inhalant use and inhalant, but substance use and substance withdrawal. But this one, some of the research shows that the symptoms of the withdrawal from the inhalant is usually similar to the moderate to severe cocaine use disorder, but it's not listed in the DSM-5 TR. Now, epidemiology. 6 out of 1,000 United States children between age 12 to 17 may be user of the inhalant. And that number is relatively high if you're looking at it. If you look at the whole population of the children between 12 to 17. And mainly these numbers fluctuated in past 25 years. It goes up and down. And when it comes to the adolescent range of the user between male and female, there is no difference. But when you get adult, older, usually the male is more prominent than the female. I've got these numbers from the SAMHSA website, and if you look at these numbers and you add a 30 to the end of those numbers, you will see that, for example, past the use of the past month, it's almost 1 million people into 2020. They used the inhalant in a month prior to that research was done, and the collection of data. And the numbers is significant if you look at it. And I will go through these slides a little bit faster, but you have access to all the slides and the information also in the SAMHSA website. Lifetime use is pretty much, significant. In 2020, it was more than 26 million people used the lifetime use of it. And the percentage is also there. Looking at the different age group between 12 to 17, something around 100,000 the people that they use it in a month before. But it goes between age 18 and older. And this is going to be into 25. You can see the difference between the different ages on these numbers when you're looking at it. And it's significant to remember that any age can be subject of this particular problem. Now, how the inhalant works. Most of the inhalant highly lipid soluble. So when they do inhale, goes to the lung, and from the pulmonary bed goes to the bloodstream immediately. So the rapid absorption is existed. What does it do? When it's lipid soluble, where do we have those more? In brain and a CNS system. So central nervous system is very vulnerable to this kind of substances, and you will see the effect of that one. What they recommend and in the mechanism of the action is mediated by the GABA receptors and glutamate receptors functioning on that membrane of the neuron in the CNS system. Within a second, you will see the effect of it. It may last between 15 to 30 minutes. That will also give a chance for the person who is using the inhalant to multiple times use it, because the effect goes away faster. May have the euphoria in the get-go. It will cause the problem with the judgment coordination, and they may use it too often and causes intoxication if they use it several times. And later on, we talk about the way that they are using this inhalant may affect the life of some people if they get unconscious or they have the loss of consciousness as a result of it. How does it work when it does some of those substances? If it does cause the vasodilatation in the periphery, usually it gives you this sense of the heat and warmth, and as a result of that. And in the same time, when the blood flow, it goes to the periphery and your blood pressure drops down, automatically your heart rate may goes up and cause the tachycardia. So because it's happening very fast, the body cannot adjust with it as soon as it happens. So that hypotension and tachycardia reflects in a second after inhalation. Now, how do they use it? In United States, the most frequent use inhalant is glue, shoe polish, and toluene. Gasoline and lighter fluid can be used. Nitrous oxide can be used, and spray paint can be used. So you can see the percentage of those. And one thing that is a problem is most of this product is not only one items or one substance. It's a compound toxic things that is involved in each individual. Now, there are three ways of using the inhalant. Sniffing means that you put it on a warm plate and heat it up, and it can vaporize and you can sniff on that. And some of those people use the liquid substances and they put it on a cloth or any kind of things and put their nose on it and breathe on that one, which called huffing, and or put the substance in a bag and either cover the mouth and nose and head with it, and they call it bagging. The concentration goes up from the sniffing to bagging. So if someone is sniffing, they use less of the substance. When it goes to the bagging, the chance of the getting intoxicated is higher, especially if the substance causes the person to lose the conscious. And if they cover their heads with that bag, it can cause suffocation. When you look at the signs and symptoms, I'm not read through it, but there are two different categories. General, usually the mood swing and having some of those hostile behavior. You can have the nosebleed, for example, blister of the nose. That is very important to pay attention. Nausea, vomiting, GI symptoms. The CNS effect is pretty much obvious. We talk about it, that it may cause the problem with the speech. Some people hallucinate and being, disoriented and having a different level of the consciousness. Coughing, wheezing is usually for those people that chronically using the substance in inhaler would be something significant. Now, for example, someone is glue sniffers, they may have this dermatitis around their mouth and face area because of the exposure to those toxic substances. So you can pay attention to that. So what does intoxication look like? So intoxication of the inhalant is similar to intoxication with the alcohol. So you can expect some of those symptoms of the dizziness, incoordination, slurred speech, unsteady gait, lethargy, depressed reflexes, and all those tremor, general muscle weakness, blurry vision, and some people may have euphoria as a result of the intoxication. So, but the effect of the inhalant usually goes away fast enough. So when we get to the point that we want to treat the patient, it's mainly supportive treatment that we are doing. Excuse me. So there are some significant substances that may cause some particular symptoms defined by that substance, and that is listed here. But as I said, most of the people that they are using, the sources that they are getting the inhalant for the use is a mixture of the several substances. You're expecting multiple symptoms comes with that. Supportive care, supplement of the oxygen is very important during that period of time, and also making sure that the patient's respiratory system and heart is evaluated and the patient doesn't go through any kind of the arrhythmia. Checking the potassium is very important. Most of those substances sometimes affect cause the hypokemia. And if there is any particular substance that has antidotes that could be used, but it's hard to have that We know that some of those products does have a lead in it and can cause the lead toxicity. From the psychiatric care, patient, if they found that the patient has the inhalant use, needs to be screened the same way that we do for any substance use, asking about the depression, suicidality, and safety of the patient. Is mainly needs to be referred to the people that they are involved in addiction treatment, and they can provide the patient some treatment such as the psychotherapy. There is no particular medication that is recommended for that, but we need to make sure that we cover the comorbid medical and also the psychiatric problem in the same time. There are some benefit of the residential treatment environment, which is not available for everyone. Most of the time, the treatment of the patients is a little bit mixture of the several things. And we need to be careful about the people that they are getting treatment for any substance use, to pay attention to the inhalant use as well. That sometimes when we treat them with the for the opioid use, for example, or alcohol use, and they are doing good for that one, they may increase the use of the inhalant if they were people that they were using it in the past. The problem is there are not too many systematic comparing different approaches of the treatment. And so we need lots of research on that. These are my references, and if there is any question that I can answer, I will. If I don't, then I will find the answer for you later.